So Barbara, you have to mute. So there's the metabolic, right? There's also nutritional. So let's say someone is not getting their calcium, the vitamin D, or the magnesium. Again, this is coming up a little faster, but this is great. We can dive into maybe some exercises later with all the time saved. So let's say maybe someone is not absorbing all of the calcium, the vitamin D, or the magnesium into the body. Magnesium is a very, very unique nutrient or uh, vitamin that will help one absorb calcium better, right? So let's say I'm drinking all the milk in the world, not all of it gets absorbed. As magnesium, right? And will absorb a little bit more than what will be absorbed without. So there's a nutritional aspect to osteoporosis as well. Let me get this off. And then there's like actual exercise and movement. If I were to be in a full body cast, lying on my bed like this for hours on end, it's a whole use it or lose it sort of theory or phenomenon. I'm not using my bone, I'm not using my muscle, like it's just gonna waste. Like everything is just gonna get super soft, just again, just kind of waste away. No muscle, no bone tissue, like it's kind of declining. So those are three of the main reasons why. Of course, there are other factors that come into play. This case,
One question.
yes.
And that's the vitamin D, the good result, but not to get better the osteoporosis. Vitamin D.
You're asking if the vitamin D will help with osteoporosis?
I don't know.
But that's
I
a question.
like they said, in the sun is very important.
Yeah.
And then the vitamin, supplement.
Right.
Yeah.
Right. Yeah. So this is where I'm going to jump around a little bit. So the woman that I'm treating, she's like 70 years old. Again, glioblastoma, and she's actually come to me because she had a compressed vertebrae. She had a fracture. So, she says, well, what can I do about the osteoporosis? And I'm asking, well, what has your doctor said about the osteoporosis? Because what's driving it? Again, what are the reasons why one could develop osteoporosis? I could have given this woman all the exercises in the world. She could have been hooked up 24 hours a day into, this vitamin D, calcium, magnesium, like she's getting it throughout the day, but if those aren't the contributing factors, it's not going to help, right? So for her, we're more dealing with again like what is happening metabolically with her body, and she has an autoimmune sort of disease, if you will, cancer, and like that's what's taking root in her body. So I could help her to kind of save off.
And a little closer to mine. If you can do it the other way, I think you can do that too, because I think it's easier.
So like facing this.
A little bit there. Can't really do much about that.
Can you move this?
No, don't do it on that because it'll fall. Closer, and that should be better. I know, that was my bad. I apologize for that. Can't take me anywhere.
Yeah, where I was.
You're talking about your patient.
Right. Yeah. So yes, I still give her exercises. We worked a lot on biomechanics, things like that. But for her, nutrition wasn't a thing. I think for you, you would also have to check in with your doctor who's ever performing these sort of DEXA scans on you to figure out if you've already confirmed that you have osteoporosis, but what's driving that?
About old age, as you get older, is it naturally occurring? Or
Yes,
just if I get old and I exercise, 100 times a day, it'll go away?
I don't think this is something that's necessarily going away. I think this is like what comes with old age.
To minimize it.
Yeah, exactly. Like you can minimize, just like you can minimize osteoarthritis. This is something that's going to happen. Like, so I look at research just for fun, and to keep my license, active. But I look at research and let's say like I look at MRIs and they'll take healthy individuals, healthy meaning no pain whatsoever. They can do everything that they want to do, whether it's sprinting or doing a marathon or like gardening in the backyard. Like healthy individuals to get X-rays, right? And they have a huge range, from 50 years old, 60, like 70, right? And even like 20-year-olds, they're already showing like very early signs of osteoarthritis, right? And no, arthritis. But what I'm trying to say is, these are things that are naturally happening. Like if I get a patient that comes to me now, like, here's my X-ray. It says I have arthritis everywhere. It's like, now you're 76. I know. Yeah. It's like this is something that comes. So
It's gonna happen.
it's gonna happen.
Like wrinkles.
Like wrinkles. Yes. Yeah. Like wrinkles. Yeah. Like wrinkles. Absolutely. Yeah. So it's a silent symptom osteoporosis. You want them to know. You want to know until snap, until break, until hospital. Oh, you'll know. You'll know. Yeah, absolutely. Yeah. With osteoarthritis, you're looking more at joints. What's happening between two bones. So what tends to happen again with age. You take a 5-year-old who's only been on his feet, maybe 3 years, and then like a 76-year-old who's been on their feet for so many years. There's going to be a lot more wear and tear on that older individual, and that's what I mean by these things happen at natural.
Very simply, are you saying that osteoarthritis has to do with bone connection, bone
joints?
Contact?
Yeah, osteoarthritis.
Arthritis.
Yeah. Joints.
Okay, thank you.
That's correct. Yeah. We are going all over with bones. All right.
About responding.
Yeah. So the osteoarthritis, which is going to be involving the joints, and this is more like the wear and tear. Maybe I'm maybe not. I'm a manual therapist. I do a lot of massage. I should expect in my older years that these guys are hurt, right? Because I'm using them all. Whereas my mother-in-law, who has rheumatoid arthritis, it doesn't matter what she does with her hands. It's an autoimmune disorder, right? So they're always inflamed, swollen, and they're hurting all the time. For her, it is actual exercise. So, difference between osteoarthritis and that fitting into primary arthritis versus rheumatoid arthritis, and then osteoporosis, which is happening within the bone itself. Okay? So I can have, not going to wood, I can have osteoporosis in my femur, but I have osteoarthritis in my knee, and the rheumatoid arthritis. That's correct. Those who have osteoporosis, because again, we're talking about something very brittle, something fragile, right?
You show the image. You show the image of osteoporosis.
Yeah.
That's not the outer part of it.
This is the inner part of it.
The inner part of it.
It's becoming more hollow. Yeah.
Anything can fracture.
I wouldn't say anything, and it depends on the severity of the osteoporosis. Yeah, so not everyone who's like osteoporotic is going to go smack their arm. Oh, yeah, well, of course. Hospital, here we come. No, that's not exactly it. No, these are accidents that are happening. And I'm happy you brought that up because, like, they can come out of seemingly you know, from some very innocuous activities. You know,
For
things that
example?
they can show you. Sorry, I just wanted to go over like a little bit of the healthy bone versus the osteoporotic bone. You see the healthy bones, like you see like the space between like, these sort of like darkened areas and lightened areas, like they're minimal, right? But here over here, you got what really looks like a sponge, right? It's almost like turning into like Swiss cheese, right? You know, let's play with that example. Let's say that this normal vertebrae over here, this healthy bone, was solid, right? Because that's more or less what this picture is trying to depict. Whereas this osteoporotic bone, Swiss cheese, right? Like it's already taking up less space. That makes sense. Yeah, yeah. So if I were to like fold that cheese in half, the healthy bone, you know, like it's going to be overlapping on one another. Like, you know, whereas the Swiss cheese, if I were to fold that, it's still going to be holes, right? It's not going to be as solid as it could be. That's what kind of makes it a little more weak. That makes sense. There was a question that came up as to why, or you know, how these things happen, how does one sustain a fracture that's coming up. Well, first, I just want to tell you why just knowing about osteoporosis is important because, again, it is silent. Some people don't even know that they have it without, again, like getting like a DEXA scan to check for the quality or the density of the bone. And something that one might be able to talk about with their primary care physician and getting checked out. But yes, they could lead to fractures. These fractures could be super duper small. Right? So we gave the example of like bumping into something. What happens if you do trip? You know, and even if you like fall onto a chair, a hard chair, but you still fall into a chair, and you didn't know you're osteoporotic, but you are, and boom, there goes your fracture.
And you don't have to hit on any part. You can be walking.
I don't know. It would still have to be some sort of impact. We could talk about it because not, you know, walking on flat surface might be different from walking on the downhill, right? So we'll get to that in just a second. But what I want to paint a picture of, you could be totally healthy one day and you trip and you fall and you fall so many times. This one's different, right? So I'm trying not to scare you all, but like this is what can happen. You end up in the hospital. Now you're using a walker. You're trying to get back on your feet, and now there's fear of falling again because you didn't know that this could happen the first time. You know, and what does that do for your balance? Now you're, I don't know, you have this disdain for the walker or the cane, but you can't, you know, really live without it. And you go. Your friends are inviting you out, and you don't really want to go out with the walker because it's cumbersome, right? And then you're not moving as much. Muscles get weaker, stiffer. I'm trying to highlight this sort of very, very, you know, downward spiral that one could go down if they're not careful about addressing the osteoporosis. You're going to be losing a large sense of your independence. Not you. So the main areas where people are having these fractures are in the spine, the hip, and the wrist. Spine, I'll show you in just a moment. Again, some very, very, you know, you wouldn't expect this to happen. The hip, a lot of times it comes from the falls. The wrist comes from falls. What isn't here is also the proximal humerus. You know, people are fracturing their upper arm as well. But this can come on from as simply as hugging someone too tight, right? So I'm getting some faces here, but maybe you remember, maybe you don't. But you know, you will get a hug from a friend. You know, hug you so tight that little bear hug, you can feel like some ribs cracking back there. Yeah, don't do that. You know, no more of that because you could end up fracturing your rib or fracturing your spine. Right? It can also come from sneezing. Sort of bilateral, that sort of compression right there in the spine. Again, this has happened. I've treated people who come into the clinic because they sneeze. That was enough to fracture the vertebrae. Yes, it can be actually. What's that? Yeah, the ribs are somewhat protected. There is a lot of muscle in between, and as we age, we actually get quite a bit stiff, you know, in the rib cage. It makes it somewhat resistant to that sort of pressure, but a lot of the times it's happening more in the ribs. Of course, there is the trip and fall. You know, this guy's kind of landing on his wrist. We always put our wrist out. Let's put our wrist out to kind of save ourselves, and that could be enough. So again, we talked about nutrition, the calcium, the vitamin D, the magnesium to kind of help to absorb those nutrients. There's the guided medications. Say it again, this have nothing at all to do with the nutrients that you're taking in, the food, the sunlight. It has nothing to do with that. It could be just how your body is responding either to hypothyroidism, hyperthyroidism is just like your body's response to what's happening inside you. And then there's exercise, right? As well as fall prep. I won't talk too much about nutrition, although if there's more questions about it, we can. And I'm definitely not going down the route of any sort of like doctor medications and what I would recommend if I were a doctor. What I can say is exercise really for anyone is going to be important, but definitely for these individuals, for this population. So this person that I'm working with, again, she has the vertebrae fracture. I think for her, she wanted to pick something up on the floor and just like extended her back a little too much. That was enough crack, right? And now she's like, Brando, I still need to pick things up from the floor, but I don't want to have this problem again. Can you help me? I could have just said, you know what? Strengthen your bones, go out for a walk, go dancing. That could be enough, right? But that might be too little of an intensity, right? Because walking isn't going to be anything like going into a squat. We're talking like different intensity of pressure on the spine, right? Different loads on the spine, and our spine is always going to adapt to the type of load or the intensity of the load that's being put. In other words, it is the use it or lose it, but it's almost like if I'm lifting 1 pound every day, you know, I get really, really good at lifting 1 pound, but I won't get any better at lifting. Right? Like you don't have to expose your body to.
Are you saying that if I lift 1 pound for a year, it's not a gap to move up? Once I get good at one, then I got to do 2, 3, 4, so on.
You got it. Yeah, exactly. So what I don't want to jump out and say is everyone should go out and do squats. Everyone should be doing deadlifts and some overhead presses to really load your shoulders, your arms, and all your bones. Although those are great exercises to do that. You can't start there because you're likely going to risk injury, right? Because if you're going with the wrong form and you were to do this sort of overhead squat, there's going to be a lot of compression forces on your thoracic spine structure, right? Let's say if you were to go out and do a deadlift, even if it's a lightweight, it could be a dowel, a stick, a broomstick, right? You go to do this motion, and you go to stand up. It's the wrong motion to be enough to kind of offset that. Again, I'm thinking more of the vertebra right now for any of these things. And hope I'm not scaring you. There are some individuals who have mild, very, very mild osteoporosis who can jump. What I want to highlight with this slide is you have to figure out like what feels right for you. Because some of you, if I were to invite everyone, and I did plan on it, we'll see in the room, everyone standing up 5 times, sitting down. You know, stand up and sit down. there to stand up and sit down 5 times. Yep, and without using your hands, you're gonna sit down. Yep, and back down. Can you slow it down? Sitting down, slow it down. Good. Can you keep your knees apart? Slowly. Very good. Coming back up. Very, very slowly. Coming back down. Good. And now you're going to start to feel that a little differently. Right? You should feel that more in your quad.
Oh, yeah.
Yeah, the slower you do it. Because otherwise you could just plop down. Plop down. And
So
a lot of
slow.
compressive forces on the spine. All right. So the slide is kind of telling a number of things. For you, that exercise might have been a little too easy, especially if you're just dropping straight down. But let's say we slow it down. It's a little more difficult, but still kind of easy. But I don't want to give you a barbell across your back. That's 45 pounds, right? I want to give you like a 10-pound dumbbell because you might not be ready for it, but you might, right? You might. And that's why it's very, very, very important that you're working with someone or enough. You can be evaluated and know what's safe. The reason why you can't just do the same thing over and over is because we're trying to load the bone. And yes, we are trying to slow down the degradation of the bone, slow down the density being wiped away from the bone. But again, it has to be progressive. So again, this slide is saying, oh, just go for a walk and go dancing. That's great. You're doing more than what you were doing before. Bone is still going to extend. So what do you do, or what can you do besides that? Let's say this person wants to walk on flat surface, and we see that here at the 1.2 and a half, right? Like that's how much load is being put onto the body. Now you're saying, I'm going out for a walk 30 minutes a day, bones are healthy. Good, right? And you do that for a couple of months, and you go in to get the DEXA, and they're like, okay, yeah, it looks good. And then you know, a couple of years go by, and it's like, nope, it's going down. I've been walking consistently for how long? What do you mean? Well, one, it's still going to go down, right? But you still have to promote that bone growth, right? And that's where you're going to have to bring up the. So, let's say someone, again, they're walking on flat surface. Well, now they're starting to walk downhill. Why? Because now it's adding a little more pressure on the hip. Tibia, right? This is, in this case, this is all for lower body. We're not talking about arms just yet. So I can give examples for that too. Again, like a 1-pound dumbbell versus 5 or 10, or like some wall push-ups. We'll do a few things here. Whereas like going uphill, you're going against gravity, right? Like that's going to exhaust a whole lot more energy than say going downhill or walking on a flat surface. So you're gonna have to look for ways to kind of boost that bone. That sounds awesome. Yeah, that sounds great.
Can you repeat?
Walking 7 stairs twice a week. I do it twice a week. Building, I live on the 7th floor,
Right.
and so in those occasions, I do not
So she's asking if going up 7 flights of stairs twice a week will be good for bone. That I mean, you see it. That's a good amount of weight being put on the bone, a good amount of force being put on the bone. Strong, healthy bones in the lower leg sounds awesome. What I'm saying is, I guess your body is kind of doing two things, right? Because you have the natural effect of aging, where your body is like, no, I'm getting weaker. This is the way it's been for the past 50 years, right? So you're combating that. But you're also, your body is going to kind of get used to those stairs and what you're going to have to do, right? So now it's 8 flights instead. Now it's.
I am on the last.
Well, you gotta go down a flight and come back.
Part of it.
Right.
Felt
Yeah.
cold.
it's not the same exercise. In the mountains, when you work up,
Yeah.
Your muscle works differently.
You got
But
it.
what is hard is to keep it down.
You got it.
Because then you have this muscle in the back
You got it.
of your
Right.
miserable.
Yeah.
I'm still doing
Right.
it when I am in the office in Italy here for about 3 weeks, and I'm doing it. But I know now that coming down,
Absolutely.
but I'm not risking to injure myself by doing it.
Yeah. Yeah.
To continue to do it.
Please. Yes, absolutely. Yeah. Again, you can always take the elevator down and walk the another flight up. So I'm happy you brought this up because even when I was, of course, I want like images to kind of help, carry my message. Some things get better through imaging. And I'm looking at this and I'm like, this isn't right. This isn't right because I know going downstairs a lot more work. So what is this? But this has more to do with the load of the bone, right?
I don't know what that means.
Yeah. I appreciate it. Bingo. Yeah, it'll be like your weight. But let's say I have a neighbor in my building. He just recently sprained his ankle. Right, it's his right ankle. Can you guess how he's standing? Exactly. Yeah, he's like this. Right, there's no weight going through that right leg. There's no load on it. Zero. Right? But what I'm saying, and I think what she could agree is, now when you're going up that step, all your weight has to go through that. And that's a lot of load on the bone. But as you're coming down, it's coming downhill, coming downstairs, coming down a hike, that's a different load. That's a load on muscle. Because the muscle has to control the load coming down. Let's say this weighed 100 pounds, right? If it's just hanging down like this, right, I don't really need to use my bicep muscle to kind of keep it up. It's just hanging. Now there is a pull on my shoulder, right? So there's a load on my shoulder. It's down, right? Nothing at all, again, to do with muscle. That's what's happening at the joint. But if I were to now start flexing this muscle, that's load on the muscle, right? But going uphill, walking uphill, this load is a lot different from walking downhill. Let's say, again, this was 100 pounds, to slowly put it down without making this room, right? I'm lowering this down to the floor, 100 pounds, that's going to require a lot of work. Now, if I were to pick up it, or pick it up without making the noise, you wouldn't know. The rock was there, now it isn't. But again, to put it down, I hope that makes sense in terms of loading bone. And just to circle back to this, muscle versus bone. The reason why, again, puts much more weight on the muscle coming downhill is because we don't want to just come down on it. Muscle, loading bone, different things. More to do with pressure through the bone versus how much effort the muscle has to go through to decrease the pressure. I wish.
If I do this,
Right.
my life.
Yeah.
Now, if you listen carefully, you hear.
Yeah. I wish I could put the microphone next to my ankle. Yeah, I can get it to go to. It's nothing to do with unhappy joints.
So you can continue and ignore it. That's what I.
You go crazy cracking your bones, the joints in your ankle. It's fine. With your hands, it's fine. There's an entire profession who's made a career out of cracking joints. You got it. Yeah, and they're not going around causing people osteoarthritis or any sort of damage from here. No matter what you do, what's important is just being consistent, right? So if it is dancing, if it is walking, if it is, the 7 flights of stairs, just keep doing it because I'll tell you, just doing something is better than doing nothing. All right. So if it's a hard sell to say that I think you should start doing squats and deadlifts, your legs are strong enough. I know it because you're going up 7 flights of stairs. You say, well, if I have to give up the stairs and do deadlifts, I'd rather not do any deadlifts. I say, fine, just continue with the stairs. You know? So long as you're again consistent with it, you're keeping up with the strength and aerobic exercise. And just a few slides left. The next big thing that I haven't touched upon just yet is fall prevention. So let's say you have all the strongest bones in the world. There's still a lot of impact if you're falling, right? So if you can prevent some falls, then let's do that. I have a really, really simple, technique, a simple exercise that I like to give people, especially those who are fearful of falling. There's a practice called cognitive loading, where instead of thinking, don't fall, don't fall, don't fall, whatever you do, don't fall, they're thinking about anything else. And when they're practicing with me, they're thinking about 4 different words, and they're counting down. I give them a counting test. Yeah. Camera is still somewhat on me. You know what?
Yeah.
Okay.
Beverly.
Beverly. I'm gonna put this chair about right there. Now, at home, this would be like a full corner. There'd still be a wall continuing here. I'm gonna ask it. There you go. You're not gonna rest on the wall, right? But this is something that you can do at home because that wall is right there. If Beverly were to fall back, back to her right or back to her left, or straight back, full wall, right? She can always just take a step back and there she goes. She's regaining her balance. Also, if she feels like she's falling forward, she has a chair right there. Very, very stable chair. It's not going to move. So, what I would do with Beverly is I'd ask her to put one foot in front of the other. It doesn't have to be a direct tandem, but just one foot in front of the other. That's perfect. Are you fearful of falling at all?
No.
Perfect. She's not fearful of falling, so probably not the best subject to use, but I do think that the exercise could help anyone. What I want you to do, Beverly, slightly forward, I actually don't want to touch anything or leaning onto anything. I want you to, not yet, but you're going to close your eyes and you're going to try to remember these 4 words. There's apple, boat, elephant, ladder. You can say it as many times as you want. Apple, boat, elephant, ladder. You can make a song out of it.
You got it? That order.
It doesn't have to be in that order. You just got to know the words. Remember the words. All right. All right. Now I'm going to have you close your eyes, and you are going to count down from 100 by 4.
Okay. Out loud.
Sure. Yeah, I'll do it with you.
Okay.
We got 96.
96, 92, 84.
We see that the balance is swing.
80, 76, 88,
Now, someone who was here. Thank you for volunteering. someone who's fearful of falling, that's going to be super difficult. Very, very difficult. They're like, count down by what? Like, no, I'm not doing that. And in the words, I think you performed on par with some of the people who might have that fearful of falling. But yeah, they'll find it very, very difficult to remember those words because again, their only thing that they're thinking about is not falling, right? So it's just one of the really, really safe, simple to do exercises at home that can help improve your balance. I'm thinking like just 5 minutes at a time, 5 minutes a day. It doesn't necessarily have to be like your feet positioned this way. You can keep them there. You can go single leg, eyes closed. You can keep your eyes open. You're kind of focusing on this and you're thinking about all the fruit that starts with P. Just anything that kind of, again, like get your mind.
Can you hold on?
What's that?
Can you hold on?
No. You can use it to regain your balance. Yeah. Always use it to regain your balance.
Triangle is your leg here.
What is it? Oh my god. We got a show off here. We got
No, but is that good for your balance?
absolutely any amount of time that you're spending on one leg and you're really like bringing more and more awareness to the foot and ankle, your hips, your body awareness, you will be increasing your balance. There's also Tai Chi, it's great for balance and coordination. Yoga, modified yoga, that's going to be great for balance and coordination. Absolutely. Yeah. Yeah.
I have to put my foot down.
So that means for the other leg, you probably want to remember 4 words, random words. And try to remember them.
But I should increase it. I have never been able to increase. I would increase once.
Could we try? Could we try?
Yeah.
Yeah, please, come on over. Yeah. The right leg, you said, yeah?
The right leg is very good. I can do.
Oh, it's the left leg.
The left leg is a wonder.
You can't get past 15. Okay. Thank you. You can come on over here. What's your name? Anna. Yes, Emily, you can stand here. Okay, would you like me to stand there instead? No, we're not ready yet.
Okay. Sorry.
Okay. So Anna, here's what I want you to do. You're going to put all your weight, not yet. You want to put all your weight through the left leg. You can work on that. Not yet. But while you're standing on just your left leg, I want you to count down from 50 by 3.
Okay.
All right? So for every even number, I want you to just touch your nose with your right finger.
Okay, well, that's getting too much coordination, and I can tell you that already.
What's that?
This is too much coordination. I'm not good at coordination, but I'll try. Anyway, I'll give it a try, okay?
I'll stand over here. Again, you're going to be on your left leg.
Okay.
Right? You're going to count down from 50 by 3.
Okay.
Every even number.
Okay,
Tap your
so
nose.
you said from 50,
50.
46, no, wait,
47.
47, okay, 47, 40, 44, 41, 37, no, 38, sorry, 38, and then I can do it. You know?
What's that?
If I have to sing, I don't know what it is, I just can't keep it up.
If it helps, you can just focus on anything but the crowd, but we'll do it. Yeah,
Okay.
You're going to stand in front.
Okay, so what do you want me to do?
I want you to repeat the exercise.
Okay, with counting.
Yeah.
Okay, wait, first of all, if I do my arm, then I will
Sure.
get more balance.
Sure.
Okay? And hold on. What is it? Hold on. Maybe you're nervous.
Performance anxiety.
Yes, performance anxiety.
That's exactly true, yes.
How about just counting down? You don't worry about the finger.
No, I think the finger is out of the
Let's just
question.
do 50. Let's just count down 50 by 3.
Okay.
It's 47,
47,
44,
44, 41,
What I was going to do is just timer, right? And I
Okay.
believe it was the first time that you actually got, very close to, if not past the 15 seconds. Anyway. Yes. Anyway, takeaway is osteoporosis is it's almost a part of life. Bone density changes with activity. Of course, there's graded activity, so you can always, increase the level of stress of intensity to increase your bone health. Gradual increase in the intensity of the exercise. So, you might start with just standing up from a chair as opposed to like doing some full-on squats. And at least some falls can be prevented. Now, if you're getting up in the middle of the night and all the lights are off, there's loose carpet, and it doesn't matter how well your balance is, you're likely to trip over something.
The rugs out of the way.
You gotta keep the rugs out of the way, keep some, some night lights if possible where needed, and grab bars as well. And of course, like staying consistent. So a homework assignment again for some of those falls that can be prevented, at least let's get rid of some of those loose rugs, put the night lights in if needed. And definitely find an exercise that works for you. You found that the stairs work for you, great. You will have to improve it. Very shortly, I would say if anyone wants to improve their balance, and this is kind of, I didn't say it, but this is kind of what we're doing. If standing like this is difficult, I'm standing on one leg, my eyes are open, this is difficult, I'm losing my balance, right? Then if I were to close my eyes and juggle, and again, like name off all these random facts while someone's pushing me, and by the time I just open my eyes without juggling, without doing any of this stuff, this has now become easy, right? Yeah, that's kind of what to take on. That's what I want you to take away from it. Practice at home by making balance difficult, but after the exercise, balance should be. Thank you, RSS.
Thank you.
Thank you, Barbara. I appreciate all of your questions. It was perfect. Oh, it does follow.
Okay, so I think Lenora's left. Lenora, did you have a question?
Lenora, did you have a question?
No. Is my hand raised?
No,
no,
just wanted to make sure you were online. I just want to make sure nobody got all right, well, thank you very much, guys. Take care.